ठीक है.
Thank you. Good morning, students. So today's topic is pruritus vulva. It is a very small topic, hardly it will take 10 to 15 minutes. So coming to its definition. So today's objectives of the pruritus vulva topic are, we will go through its definition, mechanism, how it is occurring, then etiology of pruritus vulva, how to diagnose the pruritus vulva and how to treat the pruritus vulva. So pruritus vulva means sense of itching which is confined to the vulva. There is strong desire to itch. It is not synonymous with vulvar irritation. Vulvar irritation is a painful condition and that is associated with burning. However, pruritus vulva, when it is prolonged or severe, it can lead to vulval irritation through the scratching and abrasion. About 10% of patients attending the gynecology clinic, they complain of vulval itching. So it is very common in gynec OPD. So how it is occurring? The mechanism is repetitive itch scratch cycle. There is itching, the lady will scratch, again there will be itching. So this is a vicious cycle of itch scratch. There are special sensory knobs are there in the vulva which carry this sensation of itching. Whenever there is any vascular instability like emotion or anything, the blood circulation is also disturbed and there is this sensory innervation gets stimulated and there is itching. And it is more aggravated at night. Actually the cause is at night, there is no other disturbance, and so the sensation will be more in the night. So coming to its etiology, the most common cause of vaginal itching is vaginal discharge. So commonly there is vaginal discharge is there, vaginal discharge is common, but it should be normal. Vaginal discharge is odorless, colorless, and it is not adherent to the underways. The normal vaginal discharge comes from the vulva. There are Bartholin's glands, sweat glands, sebaceous glands. From those glands the secretion comes. Also the vaginal discharge is coming from the cervix, uterine cavity, endometrium, the fallopian tube. From there the discharge comes. And it is accumulated in the vagina. So vaginal discharge is a common thing, but when it is when there is a smell is there or some color is there and it is profuse, it is adherent to the underways, that means there is that is abnormal vaginal discharge. So the most common cause of vaginal discharge is infections. The common infections leading to vaginal discharge is Trichomonas vaginalis and Candida albicans. So these two along with bacterial vaginosis, they account for around 80 to 90% of the vaginal discharge, and this vaginal discharge is the most common cause of pruritus vulva. So we will go through these two infections in detail because the infections caused by these two organisms accounts for most of the pruritus vulva. So we'll go in detail these two infections. Then other infections of the vulva which can lead to itching are fungal infection, as I told, this Candida albicans. So viral infections like herpes genitalis and genital warts. Parasitic infections like threadworm, scabies and pediculosis. Sexually transmitted disease, gonorrhea and trichomoniasis. So these infections can cause itching. Then any localized skin lesions like psoriasis, seborrheic dermatitis and eczema. Or if she is allergic to anything, it can lead to contact dermatitis. If she is allergic to soaps or detergents or any perfume, nylon undergarments, condoms or chemical contraceptives like like any copper T or any contraceptive which is loaded with the chemicals like progesterone, and she is allergic to that substance, then it can lead to contact dermatitis. Medical disorders like diabetes mellitus, thyroid disorders, liver disorders like cirrhosis, any renal function disorders leading to uremia, and hemochromatosis, this is iron deposition. All these medical disorders also can lead to pruritus vulva. Then if there are deficiency of iron or folic acid, vitamin B12 or vitamin A deficiency, these deficiencies also can lead to pruritus vulva. Then psychosomatic causes like mental anxiety and sexual frustration can also lead to pruritus vulva. Other conditions like non-neoplastic epithelial disorders, squamous hyperplasia and lichen sclerosis, neoplastic epithelial disorders like vulval intraepithelial neoplasia, Paget's disease and invasive carcinoma of the vulva can also lead to pruritus vulva. So pruritus vulva can be a very benign condition, very common cause may be there, or there may be underlying neoplastic disorders also. So you have to be very careful while taking the history, while doing the examination, and when we are doing the investigations, we have to be very cautious to know the etiology. So the etiology is very important to know from the history and examination. So how to manage the pruritus vulva? First we have to, as you know, for any condition to diagnose, we need the proper history, proper examination and the necessary investigations. So here also similarly we have to take the detailed history of the itching. When did it start, age of the onset, what is the intensity of the itching, what is the duration of the itching, is there any associated vaginal discharge, if vaginal discharge is there, whether it is itching or itching is there or not along with the vaginal discharge, what is the color of the discharge and what is the smell of the discharge, is it adherent, is it profuse or thin or thick. You have to take the detailed history of the discharge. Then we have to take any psychological history because as you know the mental anxiety can also lead to pruritus vulva, and we should also take the allergy history. As you know, contact dermatitis can cause the pruritus vulva. Then after taking the history, you have to do the proper general examination because the general conditions like deficiency of iron, folic acid or any vitamin B12 or vitamin A deficiency, or if there is any thyroid disorder or diabetes mellitus, that can cause pruritus vulva. So we have to take the proper, we have to do the general examination. Then we have to do the local examination. First you have to do the inspection whether there are any lesions, any cracks in the skin there in the local, and if there is any discharge, what is the color, odor, you have to see in the local examination. Then we have to do the perspeculum examination if needed to see any inside lesions in the vulva. Then special investigations we have to do are microscopic examination of the vaginal discharge. If the discharge is there, you have to do the microscopic examination of it, and if needed, you have to take the vulval scraping and do a microscopic examination. Then we have to do the urine test to look for the sugar, protein or pus cells in the urine. Then blood investigations like complete blood count. As you know, iron deficiency can also lead to pruritus vulva. We have to, and any infections, the lymphocytes neutrophil count will be altered. So we have to do a complete blood count. Then postprandial sugar because you want to rule out the diabetes mellitus. And as you know, liver disorders, renal disorders and thyroid disorders also can lead to pruritus vulva. So we may need LFT, RFT and thyroid function tests. And then stool tests for ova, parasites and cysts. And in long-standing cases, if she is not responding to any treatment, we may have to do the biopsy to rule out any precancerous or cancerous lesions or Paget's disease. So all these investigations you don't need in all cases. You have to take the history and general examination, local examination, and depending on your history and examination what you are suspecting, the required investigations you have to do. Then coming to treatment, the general principles for treating pruritus vulva in any case is, first thing is local hygiene to be maintained, and we have to tell her to wear loose fitting cotton undergarments, and we have to prevent the vicious cycle of itch scratch. So if this cycle is broken, then there will be improvement in the condition. If this itching is continuing, again she will scratch, again there will be itching, and it will lead to irritation and secondary infection. So we have to break this cycle. And the most important thing is we have to treat the specific etiologic factor. As now you know, there are so many etiological factors for the pruritus vulva. First we have to find out the etiology, and accordingly we have to treat the condition. So as you know, antihistamines are we can control the itching and also sedation. So we can use antihistamines and sedations, gabapentin or steroid ointments to control the itching. If there is chlorosis vulva, as it is seen in postmenopausal women, we can use the estrogen cream. If there is fungal infection, we can use nystatin cream or imidazole group ointments, miconazole or protimazole, and also these drugs can be used orally. If there is trichomoniasis, we can give oral metronidazole 400 mg BD for 14 days, and simultaneously we have to treat the partner also, because this trichomoniasis is a sexually transmitted disease. If there is perianal pruritus, we have to give the oral nystatin. Most of the vaginal itching is because of the vaginal discharge, and vaginal discharge in turn is its most common cause is fungal infection. So most of the vaginal itching cases, they respond to a course of antifungals. If there is hard skin and if it tends to crack, we have to give a cream of 40% zinc oxide plus 60% cod liver oil, or we can use cod liver oil directly. This will soften the skin, and the cracking will heal. As there is crack, it will be healed with this cream. Or to break the scratch habit, we can give absolute alcohol 0.5 to 1 milliliter subcutaneously. And coming to surgical procedure, if you are suspecting any malignant lesion or precancerous lesion, we have to do a biopsy and confirm it. And one operation rarely done is Bull's operation. This is done in non-cancerous lesions. If there is a non-cancerous lesion, it is not responding to any treatment, then we can divide the cutaneous nerves by a circular incision around the vulva. So only you are cutting the cutaneous nerves, superficial cutaneous nerves. That is called Bull's operation. Its effects last for only 3 to 6 months. But if there is any malignant condition or precancerous condition, we have to do extensive surgery like vestibulectomy. So other drugs that can be used for pruritus vulva is interferon. Interferon ointment 4000 units per gram, used 4 times per day for 5 weeks, and also this can be used intramuscular 20 lakhs units daily for 10 days. So your treatment basically depends on the etiology. There are so many factors, etiological factors, so the treatment is different for each condition, but the general principle is to maintain the local hygiene. So as now you know that Trichomonas vaginalis and candidiasis and bacterial vaginosis, these are the most common cause of vaginal discharge. We will go through these two conditions more in detail, trichomonasis and candidiasis. Also bacterial vaginosis is a cause of vaginal discharge, but that is not that doesn't cause itching so much as in trichomonasis and moniliasis. Bacterial vaginosis is not sexually transmitted infection, that is caused by the overgrowth of the local bacteria like Mobilingus and other bacteria which are present locally. And the bacterial vaginosis, there will be profuse discharge, and that will be frothy and that will smell. and the bacterial vaginosis is diagnosed with Amsel's criteria. There are four things in the Amsel's criteria. If 3 are there, that is diagnosed as bacterial vaginosis. So the 3 criteria, there will be homogeneous adherent discharge, the pH will be more than 4.5, and with KOH solution there will be fishy smell, and there are clue cells. Clue cells means the bacterial in the clue cells, the epithelial cells will be surrounding the bacteria, that will look like a clue cell. So the treatment for bacterial vaginosis is metronidazole. So that is bacterial vaginosis. Now coming back to our Trichomonas vaginitis, it is caused by a unicellular flagellate protozoa. It is predominantly transmitted by sexual contact. Here the discharge will be profuse, thin, greenish yellow, it is frothy and offensive discharge. It is, the smell is very offensive, and there will be irritation and itching in trichomoniasis, and there will be dysuria, polyuria. These are the symptoms of Trichomonas vaginalis, and on examination the vagina will be red and inflamed, and there will be multiple haemorrhagic spots in the vagina and cervix. So the cervix is called a strawberry cervix. So the diagnosis of Trichomonas vaginalis is by hanging drop preparation, that is normal saline you will put on the slide, and you will see this protozoa, that is hanging drop preparation. And the medium used for Trichomonas vaginalis culture is Diamond's TYM or Finberg-Whittington medium. These are the medium used for Trichomonas vaginalis, and the treatment is either metronidazole or tinidazole, and as it is sexually transmitted, both partners should be treated simultaneously. Then the other common cause, first most common cause of vaginal discharge is bacterial vaginosis, second most common cause is Candida vaginitis, and third is the trichomoniasis. So this Candida vaginitis is also called as the moniliasis, and it is caused by a gram-positive yeast-like fungus called the fungus name is Candida albicans. This is the most common cause of Candida vaginitis. The predisposing factors for Candida vaginitis are diabetes, pregnancy, oral contraceptive pills, antibiotics, and any condition which can cause immunosuppression like HIV and steroids, thyroid and parathyroid disease, and obesity. In these conditions, the chances of candidiasis is more. The symptoms will be vaginal discharge with intense vulvovaginal pruritus. So the intensity is very high in candidiasis. Pruritus is very high, is of very high intensity. And the discharge nature is thick, gaudy white, there will be flakes, and it looks like cottage cheese. And on examination, vulva will be red and swollen, and in vagina there will be multiple oozing spots. When you remove that adherent vaginal discharge, that flakes, when you remove these flakes, you will see multiple oozing spots in the vagina. So how to diagnose? We have to do one wet smear with 10% KOH solution, then you will see this yeast. The culture media for Candida vaginalis is Nickerson's or Sabarot's media. And how to treat this Candida vaginalis? First we have to correct the predisposing factors. As you know, the predisposing factors like any steroids or any diabetes mellitus, any immunosuppressive condition. So you have to correct the predisposing factors, and you have to give antifungals like nystatin, clotrimazole, and miconazole. These are the antifungals used to treat the candidiasis. Okay, thank you.